I've been in pain since I was like 10 years old, so it's kind of always been my reality.
Jane Flanders has Ehlers-Danlos syndrome on top of 6 other illnesses, and she suffers from chronic pain daily.
My pain on a daily basis with medication is a 7. So, I mean, some people go to the ER for a 7, and I'm living that every day, doing daily activities.
Jane is one of the over 25 million Americans who experience pain every day, and almost 40 million who report feeling severe pain, according to the latest data from the National Health Institute. And she says opioids gave her a piece of her life back.
I'm able to cook myself dinner, go get my own groceries, which before, that would have been the only activity I did all day, because I would have had to come home and get in bed and sleep because the pain would be too much. It's nice to be able to be a normal human.
But Jane says her road to relief has not always been easy, since the opioid epidemic has left a stigma on those in the chronic pain community who use the painkillers.
I went through a few primary care doctors who kind of dropped me as their patient because they couldn't do anything for me, basically. They cited the CDC guidelines. I had one doctor tell me, "I believe you're in pain, but you're not worth risking my license."
Jane says even doctors who specialized in pain management turned her away.
We walked out of there, my mom was with me, and we walked out of there and she goes, what's to keep you from going out and blowing your brains out?
Jane says she was eventually able to find a doctor willing to help her, though the prescription comes with strict rules. But not everyone who experiences chronic pain wants to use opioids.
My back hurts, my neck, I have a lot of pain going up in my neck, I have my skin sensitivity, my arms are really painful right now.
Lindsay suffers from fibromyalgia. She has never been prescribed opioids and hopes she won't have to.
We haven't even brought up opioids yet, and I don't know if I necessarily want to take them. I mean, my pain is terrible, but I've been dealing with it this long. We need to focus a little more on how to help people with chronic pain and to manage that better so that we don't have as much of an opioid crisis on our hands.
As for Jane, she now uses her own experience to help others. And last year, she co-founded the Chronic Illness Advocacy and Awareness Group.
That's why the opioid epidemic is big, because people were losing their loved ones to addiction. And, they stood up and said something about it. Well, now we're losing people to untreated pain, and now we're standing up to say something about it.